When PMS feels so emotionally intense that it begins to interfere with your life and become something that you dread every month, it's time to take it more seriously. Hi, I'm Dr. Samantha Das, and I'm a registered naturopathic doctor here in Ontario, and I have a passion for mental health and hormone health. Today I'm going to talk about how we differentiate premenstrual syndrome from something called premenstrual dysphoric disorder, or PMDD. Please note that this information is not medical advice. I'm here to educate and empower you so that you can have conversations about your symptoms with your family doctor, naturopathic doctor, and other healthcare providers. PMDD is a disorder that is significantly more debilitating than PMS. It may affect over 5% of North American people, or 10% of people worldwide. Similar to PMS, symptoms start before the period. They usually start a week before, but I have plenty of patients who feel like their symptoms take up half their month and start almost 2 weeks before the period. Symptoms tend to improve as the period starts, usually around day 2, meaning the second day of bleeding, but this is just an average. An important distinction between PMDD and PMS is that PMDD significantly interferes with a person's life. People can find it hard to get out of bed, relationships can become really strained during this time, and it can feel difficult to look forward to anything or find anything enjoyable. This sounds a lot like depression, right? But keep in mind that with depression, you don't see this dramatic difference in symptoms before and after the period. Many PMDD patients feel great when they are outside of their PMDD window. So once the period starts up to ovulation or a bit after, with depression, the symptoms can continue regardless of where you are in your cycle. That being said, those with a history of depression, high stress, and anxiety are at a higher risk of developing PMDD. So it's possible to have mental health diagnosis like depression in addition to PMDD. As I said, the symptoms of PMDD are similar to PMS, but tend to be more intense and more disruptive. They include things like significantly depressed mood, anxiety, mood swings and/or irritability, fatigue, difficulty concentrating, significant changes in appetite, bloating and/or swelling, breast tenderness, headaches. It can be really helpful to track your symptoms throughout the month, but when tracking, it's nice to see the whole month on one page so you can observe patterns more easily. A simple calendar where you write down the mental and physical symptoms that you're experiencing each day can work. There are also validated questionnaires like the Daily Record of Severity of Problems, the DRSP, and there are even apps now where you can track symptoms throughout the month. This helps you know how long your most difficult times are and when they tend to start and stop, which can make treatment more informed. Tracking can also help with monitoring progress, and tracking itself can help alleviate symptoms, potentially because of the sense of control and insight that it gives. The cause of PMDD is a bit of a mystery. PMDD seems to involve changes in brain activity and neurotransmitters like serotonin, GABA, and dopamine that negatively affect mood. For example, women with PMDD may have abnormally functioning serotonin systems during the pre-period stage of their cycle. Many wonder if a hormone imbalance may be at play with PMDD. That information is not completely clear in studies, but researchers have found that women with PMDD have nervous systems that are more sensitive to the natural hormonal fluctuations that happen throughout the month. This leads to greater changes in mood and physical symptoms compared to those who have less sensitive nervous systems. An increase in inflammation may also contribute to symptoms of PMDD as well. I'm not going to dive too deeply into treatment because this video is more about understanding and recognizing PMDD. In conventional medicine, one of the first lines of treatment is an antidepressant that influences serotonin, so an SSRI. As a naturopathic doctor, I use herbal remedies and certain nutritional supplements that have evidence for supporting people with PMDD. Diet and lifestyle recommendations can also make a difference. When patients are in the midst of their PMDD symptoms, it can be really hard for them to take care of themselves. So it's important to have a plan that is easy to follow when feeling really down or really anxious. Sometimes it feels impossible to follow the diet and the lifestyle and the supplement recommendations during difficult weeks. So staying healthy during the well weeks and having a simpler self-care plan during the difficult weeks can make treating PMDD less overwhelming. If topics like mental health and hormone health are important and interesting to you, I will be posting more videos like this on a regular basis. So subscribe to stay in the loop. Comment below with any questions, thoughts, or topic requests. And thanks for listening. I will see you next time.